you can't do this talk without just a little bit about prostate cancer overview and where we're at. Mainly, what is focal therapy? Maybe a lot of you not heard that term. We're going to talk about focal. Sometimes in the talk, you'll hear me mention regional. We'll delve in that a little bit. Then what are the types of focal therapy that can be done, thermal versus non-thermal? It's going to be a huge key concept for today. The NanoKnife system, how it basically works, try to put those in some very basic layman terms. So when you have patients or people you want to talk to, you can make it very simple. As we've said, I'm from the South, so South equals simple in my book. How's the NanoKnife different? That's going to be the meat of this. There's a lot of things that are just changing and evolving very quickly, very rapidly. And then who's a candidate? So if you leave anything here today, one of the things I think from a prostate cancer standpoint is a lot of people are candidates that you may not hear about or think about. So really, prostate cancer, basically about 1 in 9 men get prostate cancer. It is the most prevalent male cancer worldwide. I was a little shocked at this number. I had not looked it up in a while. 1.5 million men per year worldwide. That doesn't count the people who are already living with it or undergoing treatment or other side effects of the disease process. So again, this affects a lot of people. That cannot be understated. This is also, prostate cancer is unique as it affects obviously the patient. And while all cancers affect the family nucleus, prostate cancer affects that in a way that most other cancers don't. And that makes it very unique because it affects the man, it affects the wife, the children, the whole family dynamics. And then we cannot lose sight of that. We don't want to cure the disease, but break the man. So SOC, standard of care of prostate cancer. This is not going to be big news for anybody. Radical surgery. Basically, Young, I think, as in 1909, did the first prostatectomy. That was open surgery, obviously. Now, we've changed how we do open surgery, different techniques, different approaches, but it's still surgery. So then a big change came around in 2010 where we had a lot of people going to robotic surgery. I think it was very rapid, about 5 years. We went from 97% open to 97% robotics. But again, at the end of the day, it is still surgery, still removing the organ. That was an enormous advancement, quality of life, all these things, but it still was at its bare essence surgery. Radiation, we all know about radiation, been around for a long, long time. It can be internal or external. External is your traditional radiation where a person goes to a radiation center. We cannot forget proton beam. While the new guy in the radiation realm is still radiation, the side effects are still those associated with radiation.